Hi, my name is Severino. Today I'm going to be giving you a video demonstrating trach suction and trach care. This is my patient, Mrs. Gerban. So the first thing that we're going to be doing prior to entering the patient's room is we're going to go through the patient's chart just to look at some of the vital signs and any other information we might need to know about the patient. So I see here in her chart we have Mrs. Gerban. Her date of birth is 1/17/30. I see here that her respirations are 22 breaths per minute, which is high, and her O2 saturation is 92%, which is low. I also see here her oxygen is normally set to 2 or 3 liters. And she has no known drug allergies, but she is allergic to strawberries and bees. And moving down under physician orders, I do see that there is an order to titrate SpO2 to 65% with oxygen via trach cuff, which is the only order I see here concerning her trach. So now what we're going to be doing is we're going to enter the patient's room to perform trach suction and trach care. Hi, Mrs. Gerban. How are you? My name's Ashley. I'm going to be your nurse today. So today we're just going to do some trach suction and trach care. So I'm going to close the door first to provide some privacy and perform some hand hygiene. Okay, Mrs. Gerban, can you tell me your name and date of birth? My name is Mrs. Gerban. My date of birth is 1/17/30. Okay, good. That matches my chart. So what we're going to be doing today is we're going to be performing trach suction and trach care. If at any point during trach suction and trach care you feel like you need oxygen, please just let me know. The reason that we're doing this is I noticed your respirations were at 22 breaths per minute, which is high, and your O2 saturation was at 92%, which is low. So we're just gonna, before we begin, we're just gonna get some vital signs, and I'm just gonna get assess your lung breath sounds. Okay, very good. So I'm going to put the bed in a high Fowler's or a semi-Fowler's position, which is optimal for doing your trach care. I'm also going to raise the bed to my height and put down the side rail. So before we begin, I'm going to set the suction to 80 to 120, which is an appropriate suction for an adult. And I'm also going to pre-oxygenate the patient with 100% oxygen. So I'm going to turn the oxygen up. The patient has an oxygen mask on. While I'm pre-oxygenating the patient, I'm going to open my sterile field. So some of the stuff that I have is I have saline, which I'm going to open. I have, I'm going to open my packages away from me to maintain sterility. So I have the suction catheter here. I'm going to open up away. I have my trach dressing kit, and I'm going to open that away from myself as well. And I have my inner cannula, which I'm going to open away from myself. I have my sterile gloves down here. This is my other sterile saline for when I'm cleaning the patient. So you want to make sure that everything in the packages remains sterile. I'm going to take my towel and put it on the patient just in case there's any dripping or anything like that to keep the patient dry. Okay, so the first thing I'm going to do is, Mrs. Gerban, do you have any allergies? I have no known drug allergies, but I am allergic to strawberries and bees. Okay, so with that, we're going to begin your trach suction and your trach care. I'm going to put my sterile gloves on. So when I'm putting sterile gloves on, I'm going to grab by the cuff. I'm going to make sure that I don't touch only the outside of the wrapping up to 1 inch from the edge to maintain sterility. I'm going to grab the inner cuff. I'm going to place my right hand in, and then I'm going to use my sterile fingers to go under the cuff of the second pair of gloves, and I'm going to put my second hand in. I'm going to make sure that I don't touch my skin at all with the sterile fingers, and then if I'm going to go under the cuff of this one and just pull it up to make sure my gloves are fully covering my hands. So when performing my trach suction and care, this is going to be my clean hand and this is going to be my sterile hand. So I'm going to take my suction with my sterile hand. At this point, both my hands are sterile. So I'm going to take it, I'm going to wrap the suction tubing around my fingers like this, making sure that nothing of the tubing hits my arm or any non-sterile part. And I'm going to now make this my clean hand. I'm going to remove the oxygen from the patient. And I'm going to, before I remove the oxygen, I'm going to take my suction tubing and I'm going to attach it to the white portion of my suction tubing. So now this white becomes non-sterile. So you want to make sure that it doesn't hit anything or come close to the sterile portion of your tubing. So now that that's attached, we can remove the oxygen. And I'm going to take the tip of it and it's going to go into the inner cannula. And you want to insert it about 12 to 13 centimeters. And then what you're going to do is you're going to take your clean hand and only touching the white portion, you're going to remove or withdraw the suction tubing for 10 to 15 seconds, performing a swirling motion, and you're going to intermittently hit the suction. When you're going in, you want to make sure that you do not hit the suction going down. You only suction when coming out. So once that's done, you're going to replace the oxygen onto the patient to oxygenate the patient. You're going to stick the tip of the suction tubing into the saline and suck up some of the saline to clear the tubing. We're going to do the same thing 2 times. Remove the oxygen, put the tubing down the inner cannula, 12 to 13 centimeters, withdraw, slightly swirling, for 10 to 15 seconds, replace the oxygen. While you're withdrawing, make sure you're intermittently hitting the suction, put it into the saline and suck some of the saline through to clear the tubing. And we're going to do the same thing. Remove the oxygen, put the tip down the inner cannula. Then you're going to swirl and withdraw, intermittently hitting the suction for 10 to 15 seconds. Replace the oxygen back on. At this point, your suction tubing is done. So you're going to take your suction tubing and you're going to dispose of it. And then what you're going to do is you're going to use your sterile hand and you're going to remove the inner cannula, maintaining sterility. Put the oxygen back on. We're going to take our new sterile inner cannula and put the new sterile inner cannula in, put oxygen back on. So at this point, the new sterile inner cannula is in, the suctioning is done. We're going to use our sterile hand to remove that dressing underneath. Gently, and you want to make sure that your clean hand is always securing the faceplate so that the tracheostomy does not come out. You're going to dispose of this dressing, and at this point what we're going to do is we're going to remove our gloves, dispose of them, perform hand hygiene, and we're going to put on a new pair of sterile gloves. This in the same fashion that we did the first pair. You're going to grab the cuff, slip your hand in, making sure that your hand does not touch anywhere on the sterile glove other than the cuff. Take your sterile fingers, go underneath the cuff, and put your second hand in. Pull up, and then use this to go under the cuff again and pull up, making sure nothing from your hands hits your skin. So now what we're going to do is this again is going to become my clean hand. This is my sterile hand. I have my other sterile saline, different from the saline we used before. You're going to take your Q-tip, you're going to dunk it in the saline. you're going to secure the faceplate. Take the oxygen off, secure the faceplate, and you're going to use one Q-tip for cleaning underneath the faceplate. And then garbage, dispose of that. You're going to use the other Q-tip on the top, making sure to secure the faceplate at the same time. We're going to put oxygen back on to oxygenate the patient. We're going to get our... Always making sure to put oxygen on the patient if needed at any point during the cleaning process or the suctioning process. Remove it. We're just going to dab it with a 4x4, securing the faceplate and dabbing the top. Put the oxygen back on. The last thing we're going to do is we're going to grab our pre-perforated or pre-dressing. We're going to remove the oxygen and we're just going to place it underneath, trying to maintain sterility as best we can. And once it's passed underneath the trach collar, we can use, both our hands will become clean and we can just pull and make sure the dressing is under. Okay. Very good. We're going to want to put the oxygen mask back on the patient. The last thing that we're going to do is we're going to change the collar on the patient. So when you're changing the collar, you want to make sure that you always do one side at a time and before taking the other side off. So we're going to come to this side and we're going to remove the collar on this side. Oops, that oxygen mask is not supposed to come off. And we have the new one underneath the patient's neck already. We're going to put it on and then we're going to come to this side and we're going to remove the old and put on the new, making sure to secure the faceplate. And we are going to pull the old one out. You want to make sure when you put the new trach collar on that you put 2 fingers underneath to make sure that there's enough room and it's not too tight on the patient's neck, and you want to make sure that they can perform range of motion actions, that it is not bothersome for them. So after we do that, all of the trach care is taken care of. So what we're going to want to do is you want to make sure that you have the oxygen reattached to the patient's trach. We're going to lower it back down to 2 to 3 liters, which is where the patient is at normally. We can remove the old towel, dispose of all the dirty materials, remove our gloves, perform hand hygiene again, and then we can lower the patient's bed and put their head back again into a comfortable position for them. We want to put the side rail back up and make sure, Mrs. Gerban, that there's nothing that I could do for you. Are you comfortable? Do you need anything? The patient is okay. At that point, we will let the patient know that we are going to return and document the trach suction and care that we did. And that is it.